I want to do this. Is that a heart? Hello, 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 my friends. My name is Jill Osborne. I am the president and founder of the Interstitial Cystitis Network. It is Sunday, November 1st. There are no fires. I can breathe. And it is time for a support group meeting. Now, listen, we're all under a lot of stress right now. I'm not sure if people are going to show up today, but I'm here. So if y'all have any questions about IC and all that sort of good stuff, I'm more than happy to take them. But in the meantime, I also have some very interesting new information that I want to go over with you guys that I learned at the International Pelvic Pain Society meeting. So hold on a sec. Hello, Facebook. Got 34 people from Facebook. Very, very nice to see you. Hello, YouTube. So if I'm looking up here, I'm looking at Facebook. If I'm looking down below that, I am looking at YouTube because we are simulcasting right now. Hello, Elena. Hello, Kathy, Alyssa, Debbie from Wisconsin. Hello, my friend. How are you today? Let's see here. Hello, Ruth. I hope that you are doing well. We are better. There are no fires. Hallelujah, baby. We'll see. I made the mistake of watching a fire documentary on Ojai that talked about a big fire that started on Halloween. So I'm not the brightest bulb when it comes to protecting myself sometimes. Hello, Barbara on YouTube. Hello, Donna, my sister. How are you today? Hi, Andrew. Hello, Shirley. One of my favorite names, Shirley. I have a beloved Aunt Shirley myself. Well, let me just introduce myself here for a moment. So I'm the president and founder of the Interstitial Cystitis Network, the longest serving IC support group leader in the United States, very close to being the longest serving support group leader in the world. I bring to you 3 college degrees. I have a degree, I have a degree in chemistry. I have a degree in pharmacology, drug development, master's degree in psychology because I did not like drug development. I did not like the work that was happening with animals, so I gave that up. And the IC Network was my doctoral dissertation proposal on how to bring support to patients who are homebound, and that was 27 years ago. And even though I couldn't do it because I couldn't sit in a car for 5 years without crying my eyes out, much less drive to school, I am living proof that you can get better. I had a doctor say to me, "You will forever be a burden on your family. You will always live with severe pain. Get used to it." He was wrong. I am pain-free most of the time. And that's kind of what I want to talk a little bit about that today anyway. So let's just wait just a couple of more minutes. Hello, Susie. Hi, Annie. Hello, Noreen. Hi, Julie. Julie from Louisiana. I hope you guys did okay with the hurricane that just went through. Hi, Deb. Hi, Wendy from Texas. My mother was born in Bahia, Texas. I've got family in Texas. Hello, Barbara. Hello, Andrea. It's nice to see you too. Now, you guys. Oh, look at that. My sister's calling. Hold on a sec. Hey, I'm doing a live support group meeting. People can hear you right now. So you want to talk later? Jan, I'll talk to you later, okay? Hello, Ruth. Hello, Rhonda. Hi, Lynn. All right. So, in and amongst the fires, every Saturday morning for the last for the last 4 weeks, I've been getting up at 5 in the morning to attend the International Pelvic Pain Society meeting. And the International Society has been around for, I don't know how long, 20 years maybe. And they're really dedicated to the study and even more importantly, the treatment of patients with pelvic pain. And they're very multidisciplinary. They don't just have urologists, they've got gynecological therapists, which is something that we clearly know. I mean, if there's one thing we know about Western medicine and patients with IC and pelvic pain is that the weakness of how patients are treated is the reluctance of doctors to look beyond their specialty. So as an example, urologists focus on the urinary tract. So if you go in with pelvic pain to a urologist, the odds are they're going to tell you you've got some sort of urinary issue. That's where they're going to focus their time. A gynecologist is going to focus on the reproductive system. My gastroenterologist is going to focus on the bowel, and a physical medicine specialist is going to focus on the muscles and bones. The problem, of course, is they don't necessarily understand the relationships. And if there's one thing we really clearly understand is that the structures in the pelvis are incredibly close and connected. They influence each other greatly. And so the nice thing about the International Pelvic Pain Society is that they have, from day one, really respected relationships. We're not thinking of IC again as a bladder disease. We're thinking of IC as a pelvic pain syndrome, right? Hold on one sec. I'll be right back. I hear somebody calling me. Hold on. I care for a 98-year-old and a 91-year-old. So give me a quick moment. Okay, everything's fine. I got woken up at 3 a.m. My mom had a massive bloody nose. Whoo! She cut her nose in the middle of the night. So we were up for an hour dealing with that last night. Okay, so what I like about the International Pelvic Pain Society is they're not a one-trick pony. They look at everything, and that is really why I has failed so badly in the last 30 years. Remember, back in the early 1900s, when a man or a woman had frequency urgency pressure pain, they assumed that it was a bladder disease. And when they looked inside the bladder, they saw ulcers, Hunner's ulcers. So they assumed that IC patients all had these really weird ulcers on their bladders. But here's the problem, a lot of people didn't. Then in the 1940s, technology got better, the cystoscope got better, and they started looking at the bladder, and they confirmed that, gee, the great majority of patients actually didn't have ulcers, but what we did have are little red spots, petechial hemorrhages, right? And so then we thought that was IC. But then more research emerged, which showed that a lot of IC patients have irritable bowel, and they have fibromyalgia and chronic fatigue syndrome and TMJ and low thyroid, right? And so the world slowly got bigger. In 2008, the National Institutes of Health released their first formal research study testing the effectiveness of muscle work in reducing the symptoms of IC. And guess what? The data was stunningly good. And it was at that moment when that study came out that the IC world had to it put the IC world on its head, because up to that point, really everybody was still focusing bladder. But if muscle therapy relieved bladder symptoms, gee, maybe for some of us, there's a muscle issue going on, right? And so it was at that moment that the IC world at least had to accept the fact that muscles were involved in a lot of people, right? And interestingly, there was such, let's see, how do I want to say this? In 1987, the National Institutes of Health released their first formal diagnostic criteria for IC for research studies. And that required the finding of either Hunner's lesions or these little red spots, petechial hemorrhages on the bladder. But a subsequent research found that diagnostic criteria excluded 60% of patients. So we knew that didn't work. We know a lot of us, myself included, have a completely normal bladder. So if they're saying for research studies, you got to have a lesion on your bladder or you got to have red spots on your bladder, then what about the 60% of us who have a completely normal bladder, right? Then the American Urology Association released their guidelines on IC in 2011, and they abandoned all of the findings of the bladder. They said, okay, we're not even going to look at the bladder wall per se. I mean, we're not going to consider the Hunner's lesions or the glomerations as important when compared to symptoms. So if you look at the American Urology Association guidelines for the diagnosis of IC, they really focus on symptoms. So you've got frequency, urgency, pressure, pain in the absence of an obvious cause. And yes, clearly some people do have lesions, but not everybody. This year has been interesting because at the American Urology Association meeting this year, we threw out the finding of the red dots altogether, glomerations. We now believe that glomerations are meaningless. Okay, why? Because when you test patients who have no bladder symptoms and you do a hydro, guess what happens? Red spots. So maybe, just maybe, the red spots are because of the test. And that's really the general assumption now, is that if you got the little red spots on your bladder, the little pinpoint hemorrhages, that's now considered fairly meaningless. Because if you got red spots and no bladder symptoms, you do not have IC. Okay, that makes sense? Okay, so clearly our world is expanding. And then, of course, we now have the concept of subtyping. We now understand that there's tremendous diversity in this patient population. We understand that for some people, IC begins in childhood. For others, IC begins after menopause. For some, it begins after chemotherapy. While for others, it begins after falling and breaking your dang tailbone. Are we the same? No, we are not the same. There's tremendous diversity in this patient population. And treating patients with a one treatment fits all approach, Elmiron for everybody, has failed since Elmiron was approved. And of course, the tragedy now is that Elmiron is now linked to eye disease and blindness. So that's a whole nother story. So let's get back to this meeting from the International Pelvic Pain Society, because it's really making me think in a very, very different way. So about 10 or 15 years ago, we knew that there were related conditions. We knew that IC patients often had IBS and vulvodynia and TMJ and all that sort of stuff. And it was the TMJ Association that took the lead and starting what we now call the Chronic Overlapping Pain Condition Research Network. And they had been at it for quite some time into trying to understand why some of us have more than one condition. I mean, come on, I got IC, I got IBS, I got vulvodynia. They're quiet now. If you've got two of those conditions, you are diagnosed with a chronic overlapping pain condition. So what the hell is that? Now, listen, we've all been talking about nerves, right? I mean, we knew 7, 8, 9 years ago that something called neural crosstalk occurred. So that if you irritated the bowel, that the bladder would become irritated. If you irritated the bladder, the bowel would become irritated. Why? Because the nerves convene at the spinal cord in the same location, and they're actually shared nerves. So we understand kind of peripheral nerves. We understand the local nerves. But they're studying the entire central nervous system, and they have made stunning breakthroughs. And so I want to talk about okay. Listen, the first doctor I saw, Dr. Mark Klein at Kaiser Permanente in Santa Rosa, California, in either early 1993 or late 1992, told me to get a book called Full Catastrophe Living by John Kabat-Zinn. And it was a book on something called mindfulness. And of course, I didn't do it. I don't need anybody telling me I don't need anybody even remotely suggesting that my condition is because of some sort of mental problem. Like, how dare you? Shut up. Do not even go there with me. I was screaming. I could not sleep at night. My bladder was insane, right? And over the years, we know that there have been doctors who have said, "Oh, you're just overstressed," or it's all in your head and all that sort of crap. This is different. I'm going to I want to open a couple of new doors for you to think about. So in the meeting, they talked about adults who have, over the years, gotten more chronic overlapping pain conditions. And that was true for me. I mean, I had my first IBS attack when I was a teenager. My first vulvodynia attack when I was into my 20s. First IBS attack in my 20s. And so they're kind of looking at risk factors. They're looking at a sequence of events, right? And what they consistently have found is a trauma. Did you break a bone? Did you fall on your tailbone? Were you abused? Right? So that's kind of interesting. And I go back in time and go, okay, yeah, number one, I fell off a horse pretty badly. And number two, I absolutely broke the tip of my tailbone off. And I do believe that that happened before all of this began for me. Because I remember I could push the tip of my tailbone around for months. Imagine a little kid walking around, pushing her tailbone around. But I did that, right? I did that. So why would that create a foundation for multiple pain conditions? And this is where we've got to be incredibly and remarkably humble, because the central nervous system, and in particular the brain, is still a great unknown territory. And when you and I think about our life events, you think about your legs and your arms. You don't think about your brain, right? I mean, you really don't. And what we know from brain studies that are done with patients with chronic overlapping pain conditions, and again, I'm one of them. And guys, don't let any of this scare you. There's happiness at the other end of this conversation, but I really want you to try to understand this. So we know from brain imaging studies from IC patients and chronic pelvic pain patients and chronic pain patients is that our brains are functioning differently. That, for example, one part of the brain is bigger than normal. Then we also know that the way the brain communicates, the different sections of the brain that communicate, have very different communication patterns. And I can't show you the slides. Maybe I will be able to eventually show you the slides that I saw. But we know that that our brains, for those of us with chronic overlapping pain conditions, is different. And of course, that makes sense because we have central sensitization. So we've got super sensitive skin. Hello, queen, super sensitivity. Good sense of smell. Smell is absolutely a brain function. We are chemically sensitive. We are drug sensitive. We are food sensitive. So there's no doubt that our nervous system is sensitive. So what does sensitive mean? Sensitive means, so, and I think that this is like the best part of my job is that I get to take the shame away because the word sensitive has been weaponized for years. Oh, you're just sensitive. Get over it. If you were a kid, how many times did they tell you, oh, Jill, oh my God, you're so sensitive. Just stop it. And it's sad because neurologically, sensitive means that the nerve has physically changed, that it is easier to turn the nerve on normally. So take somebody without sensitivity, you put 500 cc's of fluid in their bladder, they can walk around for hours. They don't feel a damn thing. You put 50 cc's of urine in my bladder or fluid in my bladder, you better damn well know I know it's there. And I'm probably going to be thinking about using the restroom within 30 to 40 minutes, right? Why? My bladder's healthy. My bladder's normal. You look at my bladder, there's nothing physically, structurally wrong with my bladder. And yet I have all the symptoms associated with IC on occasion: frequency, urgency, pressure, pain. Why? Because my nervous system is easier to turn on. And so how does that happen? It can be genetics. I mean, absolutely it's genetics in my family. Hello, redhead, Norway. What do we know? Redheads are super sensitive and have more nerves. So I believe that a great portion of it is genetic in my family. But we also know that sensitivity can happen after trauma. So let's say, for example, you break your knee. You just fall on your knee, you break your kneecap, right? So we know, for example, that the bone will heal. The bone should heal. And we know that muscles that were strained in the injury are going to calm you with therapy, they're going to calm down, right? But what about the nerves? What about the nerves? Now you go 20 years later in that for that person who broke their knee. Oh, my sister, that's that's hysterical. Okay, you go 20 years later with the person who has a broken knee, and when a storm comes in, they're rubbing their knee. Why? They're like, "Oh god, storm's coming in. I can feel it." And they start rubbing their knee. Why? Because that's the legacy of the injury. That's the legacy of the injury to the nerves, right? If you've had surgery and they've had to cut your skin, some of you have sensitivity at the scar area years and years and years later, right? So the nervous system is not it's not like the nervous system is invulnerable. The nervous system can be traumatized. The nervous system can be damaged, right? Now, so getting back to that kid, let's think about that kid who fell on their tailbone, right? They have no clue that their nervous system has reacted to that trauma. The first sign might be at some point in time, maybe a little bit of sensitive skin in the area. Or maybe one day when they're at school, they can't sit through class. They need to go pee. Now it feels normal to them. Yeah, I just got to pee. But it becomes a pattern. Yeah, I have to pee again. I have to pee again. And eventually the teacher's like, Jill, you just went. Why do you need to go again? And you, the kid, are going, I don't know, but I got to go. Please let me go. And you know, if the teacher doesn't let you go, it hurts, right? And then maybe 4 or 5 years later, another pain condition emerges, vulvodynia, which has happened to me in high school. And then a couple of years later, supersensitive bowel, IBS. So it's really interesting. It's really, really interesting how the nervous system reacts to trauma. And they call it maladaptation, that the nervous system creates a maladaptive process that's not healthy and not normal. Now, I want to talk about something else for a moment, and then we're going to get to the good news because there's really good news here. But again, we're trying to establish context. Let's think for a moment about a puppy that unfortunately ends up in an abusive home. And that puppy walks in super happy and tail wagging, gets hit a couple of times, kicked a couple of times, and before you know it, that puppy's over in the corner underneath the couch trying to protect itself. As terrible as that is, that happens. And the same thing happens to children, obviously, and anybody who's abused. How does the nervous system respond to that? How does the nervous system respond to stress? So we know that there's physical injury, but what about, I want to say contextual, I don't know if the right word is contextual injury. When you're under stress, remember our bodies were built 5,000, millions of years ago. And we are the result of evolutionary adaptation, right? So we are, in essence, animals. And we have a very strong fight or flight response, an extremely strong fight or flight response that was developed back in the days when we had to respond to saber-toothed tigers. And so here you are, a caveman or a cave woman. You're walking out of the cave, and look at that. There's a tiger looking at you. Your body's internal defense mechanisms begin. Blood gets redirected. Blood moves away from your belly down to your legs and your arms so that you can run or fight for your life. And your nervous system, obviously, in that context, is also stimulated in very interesting and still kind of not quite understood ways. So we know that in situations where you are under threat, your body reacts to that by preparing you to flee or fight. Now let's think about that child or that puppy who is being beaten and they can't get away. What does that do to their nervous system? High levels of stress are damaging. Anxiety, high levels of anxiety change the way your brain works and changes the way your nerves work. And remember, we've got this book here. Oh, here it is right here. When It Hurts Down Here, 15 Proven Techniques for Pelvic Pain by Angie Storr, a urogynecologist in Texas. And she writes in here, this is a fabulous, cute little book, really, really helpful. The pain that is accompanied by anxiety, your brain will intensify it because your brain thinks that your life is in jeopardy. So if you're in pain and you're crying, your brain's going, uh-oh, damn, something's really bad happening, and it really intensifies the pain. Pain accompanied by laughter, your brain will minimize that pain. Because if you're laughing, well, certainly your life isn't in jeopardy. So maybe you've just tripped, maybe you've just fallen, maybe you're riding a roller coaster. So we know in the presence of anxiety, pain intensifies. We know in the presence of joy, pain is minimized. It all comes back to how the brain has responded or is responding to some sort of trauma. So this now brings up the concept of neuroplasticity. Neuroplasticity is a wonderful thing because the brain can rewire itself. Just like your muscles respond to therapy, so too does your brain respond to therapy. And I always say to patients, you are an anatomical mystery to be solved, and it is our job to create an environment that will support healing muscles, but also with our nerves, but also honestly with our brains. That if we are living in a state of constant stress and anxiety, that is going to change how your body is reacting to pain and injury. It is, in essence, a maladaptive process. And so at the International Pelvic Pain Society meeting, the entire meeting was dedicated to central sensitization and chronic overlapping conditions. And it was absolutely fabulous. Because what they're saying is, guys, we're not talking about a mental illness. This is not a mental illness. This is about the brain being traumatized at some point in time and then creating kind of a dysfunctional process of sensitivity. And that with a little bit of reprogramming, we can diminish that maladaptive process. It's called mind-body medicine. Now, again, I'm going to tell you, just like many of you, man, I just was like, I don't want to hear about that crap. Do not tell me about any of that. This is not in my mind. Please, for God's sake, my bladder's screaming. Don't even waste your time telling me to go to therapy. I don't want to go to therapy. I want you to fix my damn bladder, right? I understand that reaction because that was my reaction too. And nobody's telling you you have to be in therapy in any way, shape, or form. But what we are saying is you got to understand the context of injury and what happens when you're injured and how that creates dysfunction in how your body processes pain. I hope that that makes sense. So here, hold on a second. I am just finishing up rewriting and editing this brand new book on IC, and I just added a whole new section on this. Hold on a sec. So what we do know from clear research studies is that when patients are able to reduce their anxiety and reduce their catastrophic thinking, their pain processing improves dramatically. They experience less pain. They need less doctor's appointments. And overall, the entire volume of pain of all of these overlapping conditions diminishes. So here, hold on a sec. Let me just get this real quick. This is a big book, let me tell you. Here we go. So millions of Americans, I'm just going to read this because I wrote this last night, okay, during Halloween. Okay, millions of Americans suffer with chronic pain disorders, including vulvodynia, TMJ, myalgic encephalitis, also known as chronic fatigue, irritable bowel, IC, fibro, endo, chronic tension, chronic migraine, and back pain. When someone has two or more of these diagnosed with a chronic overlapping science has worked for more than a decade to help us understand why these conditions often occur together, and studies to continue to implicate an altered, more sensitive central nervous system. Adults with chronic pain often have a history of trauma or injury in childhood that has triggered maladaptive changes in peripheral nerves and or the brain. And brain studies in chronic overlapping pain condition patients confirm that different regions of the brain are bigger and are communicating differently than in those without chronic pelvic pain. For these patients, this author included, even minor irritants can provoke more intense pain. But there is hope, because just as the brain and nerves can be damaged through trauma, they can also be improved. And this is where mind-body medicine succeeds greatly. Chronic overlapping pain condition patients must embark upon a program designed to calm and soothe their nervous system and restore good brain function. This is known as a neuroplastic response. At no point is anyone suggesting that chronic pain is a mental illness. Rather, we're referring to the physical health and function of the nervous system throughout the entire body. A key goal of therapy is to help the nerves and brain adapt and manage pain better. How is this done? In remarkably simple ways. Regular exercise, healthy eating, and quitting smoking creates a foundation for good brain and nervous system health. Think about it. People who are deprived of sleep, what happens? They go crazy. Their brain basically gets all wacky because sleep is restorative. We need good sleep. And yes, I know some of you have to pee a lot at night. I get that. But sleep is essential for our long-term nervous system health, which is why we want to try to help you sleep more. Keeping the mind active, engaged, and important. Yes, this means by using your brain by reading and doing puzzles and learning languages. Listen, sitting in front of the TV does not engage your brain. Reading a freaking book will. Daily relaxation that keeps your stress low is critical to winding down a more reactive nervous system. Because if your stress is over the top, your pain is going to be over the top, because that's what stress does to the brain. But it is the concept of mindfulness that is the most promising. Mindfulness meditation helps to change the brain through neuroplasticity. The more calm and peace we teach our brain, the more we react to life stressors with that same sense of calm. Harvard Medical School has done multiple studies that show that mind-body medicine that teaches patients meditation, yoga, cognitive skills, and positivity results in less pain, fewer medical services, and out-of-pocket expenses. Music can also help. It not only improves your mood, it can also make beneficial structural and functional changes to the brain. Trained musicians have noticeably different development of key brain areas, such as the corpus callosum. Yeah, okay, I don't know. So turn some music on it. Turn some music on that gives you some peace and joy. Sing. I listened to Kenny Loggins right before we started. Right? I love Kenny Loggins is where I get my peace. Kenny Loggins, John Denver, James Taylor. That's where I get my peace. Chronic overlapping pain conditions should not assume that their condition is incurable. In fact, the brain and the nervous system are remarkably resilient. Patients who have had strokes can relearn how to perform basic tasks because their brain is capable of adapting. And this is neuroplasticity at its best. Research into mind-body medicine and mindfulness shows remarkable progress, which is why they are the cornerstone of most chronic pain conditions. Pain programs. Let's see. In the book, When It Hurts Down There, 15 Proven Techniques to Alleviate Pelvic Pain, Dr. Angie Storr explains that when pain is accompanied by high levels of anxiety, the brain will intensify that pain. Thus, it's important for patients to consider all factors that are adding stress and anxiety to our daily lives. And if anxiety is dominating your life, it's time to take an anxiety management class to improve your skills. And luckily, pain that is accompanied by laughter is minimized by the brain. Thus, one of your daily priorities should be to laugh more, seek joy, and do things every day that make you happy. Okay. So again, this is where Western medicine fails. Yes, you got all the symptoms of bladder issue, but the damn thing is that your bladder wall is freaking healthy, like mine, for many of you. So what is driving that pain and discomfort? It comes right back to the nervous system. So I want to go back to my model here for a moment. So we're talking about that puppy that grew up in a very, very abusive house. And that puppy now, their tail's between their legs, they hide, they're not friendly, they bite, they react, they're angry, they can be vicious because they've been bitten. They don't know anything. They don't know what love is. They've only been hurt. But if you get that puppy out of that environment, miracles happen for many of them because they can be taught love. They can be taught kindness. They can be taught that the people around them give them joy. They can be taught that their home is a safe place. They can be taught that there will be food on the table. And that puppy becomes a tail wagging love bunny that is following you everywhere and just absolutely in love with their rescuer who gave them hope. And, that's really a good way to kind of understand what happens potentially in the human body when you also are in that environment of extreme anxiety and stress and abuse. And, we do know from the IC research done at Beaumont Hospital in Royal Oak, Michigan, that there absolutely is a subset of patients with a history of abuse. Now, I wasn't abused. I wasn't abused by my family, but I did deal with an extremely childhood series of events where we had a rapist murderer in our neighborhood for years. And he targeted me a couple of times. And so I was very afraid to leave my home. And when we have our high school reunions now, we still have our survivor group. because he did rape and murder one of my neighbors. And we all knew it was coming, and we couldn't get help that we needed. And growing up in that extremely difficult environment changed me in many ways. And believe me, listen, the woman you see here is a direct reflection of what my life has been like. And what my life has been like has been challenged by, in my opinion, those really, really early events. I can't fix that. I have forgiven. I have good coping skills. I understand that what happened was never my fault. And it was hard, and it changed me. It changed me. And then the fall, definitely fell on my tailbone. So kind of in hindsight, I believe that I know what my dominant problem is. And my dominant problem is absolutely a more sensitive nervous system. And when we talk about subtyping, and for those patients who do have central sensitization, what do I say? Your job on a daily basis is to keep your nervous system calm. And that's why I'm better, right? That's why I'm better, because in my mid-30s, I got so sick of having a panic attack going to the doctor, because I would. A lot of us have medical anxiety. And I would just have this massive, massive crying stress thing before going to a doctor. I just one day said, I can't live this way anymore. I got to fix this. And I took an anxiety management class that completely changed my life. It gave me the skills to reduce anxiety and to reduce adrenaline in my bloodstream. And I have a video on that. And I haven't had a panic attack since I took the class. I had panic attacks from elementary school all the way through grad school. I did. I absolutely did. I don't have that anymore. I've learned that skill. And that's one reason why my nervous system is calmer. The second thing that I think made a huge difference for me was that I embraced positivity. I did. Somebody gave me the book, Norman Vincent Peale's The Power of Positive Thinking. And I was so sick of living in my head in this really dark place of feeling like I was being punished and feeling like it was my fault, and dealing with family members who just was like, what the hell is wrong with you now, Jill? Come on, why aren't you coming to Christmas? Why aren't you coming to the holidays? Yeah, and it was just a really dark place to be in, especially because I felt like I was the problem. I felt like I was being punished. I felt like I had done something wrong. And I know some of you can relate to this. I know that some of you can relate this way. I mean, you talk about damaged goods. Believe me, I was completely in my head. I was total damaged goods. Who the hell would want Jill Osborne? All she can do is be at home and stay close to the bathroom and cry. But then the first research study came out that talked about genetics. I was like, oh, wait a second. Because I'm not a stupid woman. I mean, I've got a presidential fellowship. I'm not stupid. But I still ultimately thought when I was in grad school that it was my fault. But then again, we had the first research study that talked about genetics. And it was like, well, wait a second. My mom has this. My mom has super sensitive skin. I have super sensitive skin. My mom has a sensitive bladder. My sister has a sensitive bladder. My grandmother has a sensitive bladder. My aunt has a sensitive bladder. And it was like a light bulb. It's like, oh, this is genetic? Oh my God. It's genetic. What? It was never my fault? The weight that lifted off of my shoulders was stunning. And when I was able to put that into context, the guilt went away, the poor self-esteem went away. I hadn't done anything wrong. You have not done anything wrong. Anything wrong. This is not your fault. You are hurt. There's trauma. And then, of course, now that we understand the concept of central sensitization, now I completely understand why every single one of those things happened in the first place. But here's the deal. I have taken control of my nervous system. And that's why I'm better. That's why I'm better. I got great anxiety management skills. Seriously, I ran for my life from a fire 3 weeks ago. Didn't have a panic attack, even though the fire burned my neighbor's right across the street, her fence in her backyard. Hey, got that close to my house. Yeah. Didn't have a panic attack when I had uterine cancer and had to have surgery. Not one, because I know what to do about anxiety now. I know that controlling adrenaline. So when I visualize a stop sign, take a slow, deep breath, in for 3, out for 3, and that neutralizes the adrenaline, that fight or flight response adrenaline from that negative thought. And then I remind myself, it's a thought. It has no power. I'm not God. I can't predict the future. What I like to say to myself is, oh my God, Jill, how arrogant can you be to assume that you can control the future? You are not God. Get a grip. It was a thought. For all you know, tomorrow could be a fantastic day. For all you know, this date could be with the love of your life. For all you know, great things will happen. So again, the point that I'm trying to make here is that nobody is saying that this is in any way a mental illness. What we're saying is that the brain can respond to injury and stress in a negative way, and it can develop what we call maladaptive processes. And those maladaptive processes are what causes the extreme sensitivity and the multiple pain conditions. And the great news is that the brain responds beautifully when you give it an environment to thrive. If you are living in constant anxiety, and frankly, honestly, seriously, aren't we all right now? Hopefully that will be over in a couple of days or a couple of weeks. But when you're living in a state of chronic anxiety, you are reinforcing dysfunction in your brain. We got to create an environment for the brain to calm down too, in addition to the bladder and in addition to the bowel. So anyway, I've been thinking, wrote that whole section for the book last night and been really thinking about this, and I'm excited. And I want to clarify that should not be insulted when somebody says mind-body medicine and anxiety management, because that will only help your brain function better. And so, but nobody's telling you, again, nobody's telling you that, this requires intensive mental therapy. This is about structural injury and changes in the brain after injury, and what can we do to restore normal brain function to calm everything down. All right, so listen, I can geek out about stuff, right? I can totally geek out about stuff. Let me get off of my lecture thing and let us take your questions. So Lisa says, does the trauma need to be physical? Absolutely not. Emotional trauma is going to do the same thing. And again, go back 10,000 years and think about that caveman or that cave woman. Their body was wired to protect them from physical trauma. But has the brain developed defenses for emotional trauma and stress-related trauma, especially in today's industrial society with stress everywhere in our daily lives? The answer is probably not. We got to learn those skills, right? Wow, Jennifer said she ended up causing her lives change when she used Elmeron. She had to take anti-rejection medication for her liver. Wow. Holy moly. So she says, how about falling and spraining my right ankle several times during my life, starting in high school? Absolutely. So one of the more interesting that I worked with is a woman in Texas who was a cheerleader. And she wasn't just a normal cheerleader. She was one of the really big athletic cheerleaders where they would do flying split jumps, where you jump in the air, spread your legs, and land right on your crotch and land on your thighs, right, with your in total splits. And she did hundreds, if not hundreds of those. And the damage that took to her pelvis, and more importantly, her nervous system, I think is really substantial. Okay, hold on a sec. So Donna says, can nerve sensitivity go away? And the answer is yes. Yes, but we have to physically calm the nerves down. And that's might be with some medication, and Dr. Weiss talks about that in his book, Breaking Through Chronic Pelvic Pain, that when he starts finding nerve involvement he used to evaluate the skin and the subcutaneous tissue. If he finds nerve sensitivity on the skin, the very first thing he did was he tried to numb those nerves, tried to calm those nerves down. We want to try to get these nerves to stop firing so that they don't overwhelm the spinal cord, which then overwhelms the brain. He did subcutaneous lidocaine infusions, et cetera, et cetera. Is the nerve damage permanent? I don't think so. I think that this is a great unknown territory here, Donna, because we're just now remember all this mind-body medicine, which really started in the 60s and 70s, traditional medicine threw out and basically said, y'all are damn crazy. And we're just now getting really good research studies like from Harvard Medical School, which is showing the incredible power of creating an environment that will help calm the brain down when it has been traumatized and stressed. And again, I'm going to accept that in my case, because I am a redhead and that is clearly genetic, I am always going to live with a certain degree of sensitivity. But then, like, I'm doing Peoria, the palmitoethanolamide, and it's amazing how good that is at calming a lot of my skin sensitivity down. But as you turn down the overall volume of pain messages, the central nervous system calms. And as the central nervous system calms and we restore normal functioning to the brain will not overreact to normal stimuli. I hope that kind of makes sense. I mean, I really want to study this a lot more. So Lisa says, could the trauma be from surgery or emotion? Sure, absolutely. Donna says, is this the PTSD of nerve damage? I don't know if I understand that context. PTSD absolutely involves brain function, post-traumatic stress disorder. That's a good question. Becky says, hi folks, Peoria has been very helpful for me too. Thank you, Jill. Let me show you guys what Peoria is. So Peoria, palmitoethanolamide. That's the active ingredient in Peoria. Palmitoethanolamide has been used in Europe for a couple of decades now for chronic pain. There are many research on it. You can go to the National Library of Medicine, go to our website first, or go to our store, and we have. Whoops! Hold on a sec. See, look at that. It's not a support group meeting with me if I don't fall. If I don't drop one thing, something's got to fall, right? So you can go to our store and then cut and paste palmitoyl-ethanolamide, go over to pubmed.gov, the National Library of Medicine, put it in there, and you'll find all the research studies. PEA has been studied with all sorts of neuropathic pain, sciatica, fibromyalgia, burning mouth syndrome, and interstitial cystitis. The IC study was released last year. And what that study found was by month 3, 87% of patients had a significant reduction in pain. And by month 6, 25% of patients were pain-free. And important to understand that these were patients who were not responding to other therapies. And again, it creates context here. It's like, okay, well, seriously, if you're giving a chronic overlapping pain condition patient a bladder therapy, that's not going to fix it. Might calm the bladder down a little bit, but that's not going to calm the nerves down. So the consensus among the researchers and the research studies is palmitoyl ethanolamide is remarkably effective for neuropathic pain. And so the formula that they used in the study is not available in the United States. So Natural Approach Nutrition created a formula that's very similar to it. So it's PEA and resveratrol. And then it's got vitamin D3, vitamin K2, calcium, and magnesium. So when I start feeling those pinpricks in my arms, this is what I turn to. I don't take it every day. Just if I start feeling my nervous system amping up, it's like, okay, I want to calm it down. All righty, let's go back to Facebook here. Hello, Andrea. Andrea, thank you for the 50 stars. I really appreciate it, guys. If you find these meetings helpful and you're on Facebook, you can give us stars, or you can come on over to our website, icnetwork.org, and become a member and get our wonderful magazine, or you can make a donation. And it would be really, really great if you could do that, because hopefully this has some value to you. I know people don't value things over time that are given away for free, but I also understand that IC patients are financially challenged. I certainly lived on credit cards for 5 years or longer, lost everything after my diagnosis with IC. So I want to make sure that you have the best information that you can be. Franny says, only fire is in your pelvic floor. So, Franny, understand that tight pelvic floor muscles are working hard. They produce lactic acid, which causes a burning sensation, which is probably the heat that you're dealing with. Hello, Boria from New York. Hello, Michelle from Idaho. Hello, Margie. Hello, Verna. Verna says, I'm very confused about the diet. I've heard that I have to adhere to the IC diet, even if foods don't flare me, because the promoted foods will cause future damage to my bladder. Then I hear about the elimination diet, which helps distinguish foods that you can eat versus ones you can't. Okay, so Verna, it really comes back to your subtype, right? Not everybody's the same. If you have Hunter's lesions, yeah, man, you are absolutely going to be diet sensitive. If you got estrogen atrophy, IC subtype 2, bladder wall driven, genitourinary syndrome of menopause, also known as estrogen atrophy, yeah, you are going to be very diet sensitive because your bladder can't defend itself from food, from certain irritating foods. And those are and then if you've got central sensitization, you might be more sensitive to foods that wind up the nervous system, like chocolate or caffeine. So, but if you've got pelvic floor, and you've been able to eat or drink things like coffee and it's never flared you, then that tells me that your bladder's healthy and that your problem is not with your bladder wall. Your problem is somewhere else. It could be a fibroid tumor pushing on your bladder, or it could be or something like that. Margie said, what is the best thing I can bathe in without getting a UTI? I'm not sure if you're talking about soaps or if you're talking about containers. All right. So if you have a plain bathtub and you've just cleaned your appropriate bleach, and of course you've rinsed it out really well, the Clorox wipes or whatever you're using, and you've washed it out really well so that there's no residue of the chemical in there, that should be fine. I see patients do really well with warm water and baking soda, because the baking soda is very, very soothing. That's what I did for my vulva when I had active vulvodynia. With respect to soap, you want to use a basis soap for sensitive skin, or a plain unscented Dove bar. Those are really the two. But hun, you don't wash. You can wash where your pubic hair is, but you don't wash on your mucous membranes. Just rinse with water. Amanda says, what if you don't have pain and your pelvic floor isn't tight? Well, then, Amanda, it depends upon what your symptoms are. If you've just got frequency urgency, we know that frequency urgency comes from the alpha afferent nerves in the bladder wall. So we've got to take a closer look at the bladder wall and see if there's perhaps some type of dysfunction there. That would be the first thing. Could you have a chronic infection, a chronic fungal infection, a chronic bacterial infection, estrogen atrophy? And also, it would be perfectly reasonable to maybe look and see if your spinal cord's okay. Do you have a bulging disc back down by L4, L5, et cetera, et cetera. So there, I mean, there's good news. You don't have pain, Amanda, so that's great. But there's still something that's compromising that nerve, and we got to try to figure it out. Betsa says, by the way, I need to say that I ended up in the hospital 2 weeks ago. I had a flu shot. Like, what else is going to happen this year, right? I had this really rare cardiac reaction to a flu shot. And my heart started racing and throwing PVCs. And I drove myself to the hospital with my heart going crazy at 6 in the morning. And what they found also, in addition to the tachycardia, is that my potassium was low. And it's like, yeah, that makes total sense because I haven't been eating a lot because of the fires and stress. So this is my potassium drink, okay? And we were just retested. My potassium is fine, but now So Betsy says, what does the microscopic blood in the urine mean? Okay, so let me get my slide here. Where is it? So let's have a lesson in kind of what we call basic bladder biology or basic bladder studies, because understand that there's still a lot of things that we as humans do not understand. We don't, we can be arrogant and think we know everything about the human body, and we know crap about a lot of the human body still to this day. And one of the things just so interesting is, think about it for a moment. The bladder is small, and then it expands, and then it contracts, and then it expands. Like, how does that even happen? It's so interesting how that happens. So this is a three-dimensional picture of the superficial inside of the bladder wall, right? So you've got a top layer of mucus. We call it the mighty mucus. The purpose of the mucus is to act as a barrier so that whatever's in your urine can't get down to the urothelium. And the urothelium, interesting about the urothelium is that these are the largest cells in the human body. They are designed to have very, very tight junctions to prevent any of this from getting down here to blood vessels and nerves, right? So we've got nerves in green, and we've got blood vessels. But the bladder, like any other part of the body, can be damaged. It can be injured. And when it's injured, look what happens. Urine now gets down here. Now, what's so fascinating is that, you tend to think of your skin as just being passive, like it's just your skin. It's like it's skin. And yet, if you squeeze your arm, it hurts, right? So we know that your skin can communicate that there's an issue. So there's communication. There's all sorts of really interesting communication pathways that happen in this level and in this level that help the bladder to respond to stressors. So at this point in time, these cells are now saying, help, help, invader, 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 invader. Even if it's just your urine, these cells are going, something's here that's not supposed to be here. Please come help me. And it triggers an immune response. And so now the immune system gets engaged, and the immune system sends your fighters, your white blood cells, into the area to investigate and kill the invader. And so what happens then is you see through the blood vessels, we've got a migration of white blood cells coming to fight on your behalf. But how do the white blood cells get from here to here? It's really interesting. And the answer is that the blood vessels open and release them. And when the blood vessels open and white blood cells, it also releases red blood cells. And so what we then see now is white blood cells in this area trying to kill whatever it is, even if it's something that can't be killed, even if it's just coffee. You're gonna see a lot of white blood cell action here. And you're also gonna see red blood cells also end up here and in your urine. And that is the source of microscopic blood. When you use a UTI test strip, it tests for two things. It tests for leukocytes, also known as white blood cells, and it tests for nitrites. Nitrites are only produced by bacteria. So if you have positive nitrites and positive leukocytes, you got UTI, you need to call your doctor, go have your urine tested. But if you only have positive leukocytes, really that happens if your bladder's injured. And it's fairly meaningless. But of course, you can always call your doctor and go have your urine tested, as I did for years, because I didn't understand a lot of this right back then. So I'm, not so worried about microscopic blood in the urine. What we're going to be worried about is visible blood in the urine. The other thing that can produce blood in the urine is cancer. And so if you were a smoker, then you absolutely need to go have a urine cytology test, which is you just pee in a cup and they test for cancer markers to rule that out. I've just got an email from somebody last week who, it turns out, did have bladder cancer rather than IC, and they caught it. And the good news about bladder cancer is it's super easy to treat. It's the easiest cancer to treat in the human body with the highest success rate if you catch it early. So if you have a history of smoking, you always have blood in your urine, you always want to make sure you have your urine tested, okay? Barbara says, I've undergone extensive reconstructive surgery on my pelvis. I fell out of an attic and fractured my entire pelvis in 2018 and 2019. They gave me a total hip replacement on my right side. The head of my femur went through my, oh my God, woman, went through my acetabulum. Needless to say, I feel this bladder. I have pelvic floor dysfunction. Most of my muscles are very weak. I cannot have normal bowel movements. My muscles can't push it out. I have lupus and IC2. What can I do? So, hon, you are a pelvic trauma patient. You are a traumatic injury patient. There's no doubt about that, because you didn't have any of these issues before this fall. And I'm so sorry that this happened to you. You're kind of like the patients I work with who were hit by cars. You are forever changed because you sustained a really significant injury and now you have a hip replacement. So, Barbara, there's something called a Somato visceral reflex. Again, your pelvis is a small confined area. Things influence each other. We know that organs can influence muscles. So if you're in pain, your muscles will get tight. That's called the viscerosomatic reflex. But we also know that muscles can influence organs. And so it is quite possible that after your trauma, you have developed significant pelvic floor dysfunction and pelvic floor tension. And what that does is that restricts blood flow to the bladder. You might even have compression injuries. You might even have trigger points that not only are restricting blood flow and muscle function, they're restricting blood flow of nerves. And then the nerves can't function as well as they need to. And that's where we start seeing muscles change organ behavior. Because if you have tight muscles that are perpetuating long-term nerve dysfunction, those nerves are going to start releasing substance P, which is going to start damaging the bladder wall. And girl, we got to throw in estrogen atrophy and your age, because your bladder is going to be changing anyway as you get a little bit older. So I don't see how you can not work on your muscles. You're going to have to keep working on try to get them as healthy as possible. My muscles are, I had that hysterectomy 3 years ago, and my muscles are absolutely changed because of that. And I have moments where I can't push stuff out either. I'm exactly the same way. It's those muscles are funky. So I would be number 1, working on your entire pelvic health. Number 2, working on those muscles. Number 3, trying to calm your bladder down now that your bladder's involved, following the diet, maybe doing things that will calm and soothe the bladder a little bit more, like some of the chondroitin-based supplements or maybe even bladder installations. And then focus also on the nervous system. Girl, you've been traumatized. You absolutely have gone through hell. And we got to make sure your nerves are really functioning normal and are at peace rather than under stress. And that's where doing some guided relaxation. There was one study presented at the International Pelvic Pain Society that talked about the tremendous success in patients who do guided relaxations twice a day. And we have the Beaumont guided relaxation series right on our website for free, and you can do those every day. And they've been tested in research studies and proven to reduce pain. Nikki says, I agree. I don't believe mine is a bladder issue. Installations did nothing for me. Diet doesn't affect me. Elmeron has minimal benefit. I don't even know why you would be on Elmeron if you're not diet sensitive. You have constant urge to pee, but no pain except aches in the vaginal area. Hello, pelvic floor. Nikki, you need to have a pelvic floor assessment. Let's see what else is going on beyond your bladder. Because if you're not diet sensitive, then your bladder wall's healthy. Do I have to look outside of that? I'd look at fibroid tumors. I'd look at endometriosis. I'd look at pelvic floor dysfunction. Anything at all like that. We have a huge list of confusable diseases on our website that you need to work through, so they can really try to figure out what the hell's going on with you. So Barbara says she doesn't want to go do pelvic floor physical therapy because after doing it for 2 years, it does nothing for you. All right. I respect that. I completely respect that. But I think given the complexity of your injury, it would be really, really smart for you to go have an assessment with a national pelvic pain specialist to see if they can find something else, like a pudendal nerve entrapment. Maybe you've got a little bit of nerve damage going on there. And so if you're in the Midwest, you would go Ken Peters at Beaumont Health. If you're on the East Coast, it would be Robert Evans, or it would be Rob Moldwin. Robert Evans is in North Carolina at Wake Forest. Rob Moldwin is in New York on Long Island. If you're out on the West Coast, it would be Christopher Payne at Vista Urology, or maybe Phil Hanno at Stanford. Nikki says, can traumatic childbirth like 17 years ago cause IC and stroke? Absolutely. Absolutely. It's so interesting that in working with patients who do coaching with me, going back in time and looking for the triggering event and considering how that was treated, if it was ever treated. For all we know, you could have scar tissue or tight muscles and trigger points in your piriformis muscle for 17 years, which could have led to long-term dysfunction in your bladder and so forth. Jennifer says, stem cell treatment worked wonders for me. No pain, no pressure. You're on a bladder vacation. Jennifer, that's fantastic. Who did it? Who did your stem cell therapy? So the assumption would be that if the stem cell therapy worked for you, that we would be looking really at a bladder wall issue. I think. I don't know. Would stem cell therapy help central sensitization? I'm not sure. Lisa says, that's what I'm wondering. Trauma like childbirth, bladder lift, pelvic surgery, hysterectomy, emotionally bad relationship, divorce, a lot of intercourse. Yeah, those are all traumatic. Nikki says, before my constant urge to pee, I had a ridiculous amount of anxiety and stress. I broke out in a really bad rash from an allergic reaction to the antibiotic. Never been the same. That's been over a year ago. Yep. Lisa says, if you're looking for Social Security disability, having therapy for anxiety, etc., would really look good on your application. I agree with that. Annie Chin said, Mind Body Medicine. If you listen to Nicole Sachs or Dan Buglio on Facebook, or that is what they talk about for chronic pain patients. Journaling and meditation will help calm down the autonomic nervous system. Exactly. Cecilia says, but how can I sleep if I get up 11 times in 7 hours? So any advice? Yeah. So Cecilia, we got to figure out what's keeping you up. If, nighttime urination is usually a direct reflection of trauma from the day. And so, are you following the diet? That would be the very, very first thing we would look at is your bladder being irritated on a daily basis by something that's provoking it, like you taking a multivitamin or drinking a cup of coffee a day or green tea a day? That would do it. Annie says they've healed hundreds of patients, reversing neuroplasticity in the brain, working with Dan Buglio. He is a TMS coach. Girl, I got to interview him for our magazine. Seriously, I have a master's degree in psychology. I do. And I was really good. I got a presidential fellowship while I was in grad school. So I knew my stuff. And yet personally, I was not ready to make that connection. I just wasn't. It's like, don't even suggest mind body stuff to me. Seriously, I'm bawling my eyes out. Now I get it. Now I understand it. And thankfully, I did kind of slowly come to it like that. So hold on a sec. I'm going to be rebuilding our website massively because of this next year, most likely. They said 99% of chronic pain patients have childhood traumas that are repressed emotions that need to be expressed through journaling because the emotions are stuck in our bodies. I understand that. I don't know. I think it's more I agree that if you have hidden it and you've never talked about it and it's just sitting there simmering, absolutely. But in my case, believe me, I've talked about it for decades. I'm not shy about talking about it at all. I think that there's grief. There's really tremendous grief. I feel like I was really robbed of a normal childhood because of that. And I became an introvert, and I couldn't trust people for a long time, especially guys. Just couldn't do it. I was that puppy. You tried to pet that puppy and it would bite you. That's how I was as a kid, especially in junior high and even through part of high school. I would just, I mean, the damage of that trauma and that abuse is real. Nan says, thanks for this. My mother was given DES when pregnant with me, so I was born with a blockage and deformity in my bladder. I had surgery when I was 3 years old. Have you heard of the DES is related to IC? Hon, it's ringing a bell. It's definitely ringing a bell, but it's from a long time ago. I haven't heard anything recently. But the fact that you had to have surgery on your bladder, that's a trauma. You know what? That is a trauma. And it'd be interesting to know what they did and what the legacy of that is, et cetera, et cetera. Debbie Hall says, for many people who are stressed, you have to let it go, accept the things you cannot change and change the things that you can and know the difference. That's true. That's very, very true. If you can't change the stressor, you have to change your reaction to the stressor. That's very true. Lisa says, where can I find an anxiety management class online? Do they have them? You know what? Just search around. Mine was at my local Kaiser hospital. And again, it gave me my life back. In fact, I was just telling somebody else about it a couple days ago. Marielle says, my pelvic floor therapist told me I'm going to try and help you because your brain is used to pain for 18 years. Yeah. Well, so your brain is so your body's in a guarding reflex. Again, think about, that puppy. They're all hunkered down. They're all tight. They're protecting themselves. Everything is super, super tight. Or if you've ever had a pelvic injury, an abdominal injury, what do? You're like this. Man, you just lock down, and so that would certainly cause muscles to be tight over time. Hello, Cara. It's very good to see you again, too. Michelle says, I'm anemic and my doctor wants to put me on iron supplements. I'm terrified it will flare my IC. And I just don't have a lot of people who shared that iron supplements have bothered them. My mom's on iron supplements right now because she can't get her infusions, and they don't flare her at all. I think you would give it a shot. Yeah, you've got to improve your diet, which is something I'm always working on with her. But if it's just not quite enough, using those iron supplements would be helpful. Name of the book, please. The book I don't know which book you're referring to. Breaking Through Chronic Pelvic Pain, A Holistic Approach to Relief by Dr. Jerome Weiss. You can get it from the IC Network shop. It is free on Kindle Unlimited. Seriously, you got to read. It'll help your neuroplasticity anyway. So sit down and read a book about this. Or When It Hurts Down There by Dr. Angie Storr. And they're both available in the IC Network shop. Franny says, what do you know about craniosacral treatment? Not a lot. Not a lot. Cara says, is there anyone who should not take Peoria? I can't ask that question for you. What I did and what I would encourage you to do is go to the National Library of Medicine and look at all the research studies like I did. I just didn't find side effects. Most of the studies showed that it was very well tolerated. I think I've talked to one patient since it's been sold who had a reaction to it. I don't remember what that was. But look at the studies and see what you think. Does Peoria interact with other medications? Not that I'm aware of. But again, you've got to do your due diligence and Google it and read about it. Cara says, so about the potassium, I read something that says it irritates the bladder. Is there a special take? Well, the thing about being low in potassium is that it's really a sign that you're not eating well. And it certainly was in my case. I lost about 10 pounds in the last 6 weeks, 8 weeks. That's what happens when you're dealing with fires and stress and all this. And I just wasn't eating. And so, I got the lecture, you got to eat. And it's like, okay, I was basically having my decaf coffee in the morning. I would have a yogurt. I might have a banana once every 2 weeks, and I wasn't eating the right foods. And it was just a reality check for me. Now I eat at least 1 banana, sometimes 2 bananas a day for my potassium, as well as eating dates. I eat dates. I eat apricots. I'm just trying to improve it. Organic dates or organic apricots. Wendy says, my urogynecologist won't test for embedded infection or anything, just IC diagnosis. She did 6 weeks ago, pelvic therapy, and now doing 12 weeks of installations. How can I get a doctor to look for cause and not just treat the condition? Well, hun, I think that when you're working with a doctor and working with physical therapists, especially if you're in pain consistently, it's over and over and over again, you have to really change the way you're talking to them, because it's not just about getting treatment. It's like, doc, I want to get better. I want to fix the problem. And I don't know if we really understand what the problem is. And so I'm ready to start ruling stuff out. done my research. I've attended support group meetings. I understand that there are a lot of other conditions that can contribute to this. So I would like to know, is there any chance I have endometriosis? Is there any chance I have a fibroid tumor? Is there any chance that my birth control that you put me on could have triggered this? Because we now know that for some patients, starting birth control can immediately trigger some bladder dysfunction. And so I think you can just kind of be just like, doc, listen, I don't want to keep coming here when I'm in a flare. I am having flares in the first place. Can you please help me understand my anatomy a little bit more? And if they won't do it, then I think you need to go find another doctor or get a second opinion. Vicky says, I've had 3 forceps deliveries out of 4. I tore the first time, now fibroids. Girl. And we know that fibroid tumors, when they push on the bladder, will cause the symptoms of frequency urgency. And we also have research that shows when the fibroid tumor is treated, that the urinary symptoms go away in at least 70% of those patients completely, and it is considered a cure. Annie, yes, could you please tell Dan Buglio that I would love to talk to him a little bit more within the concept of chronic overlapping pain conditions, and if we can create some new resources, or if I can refer our people to him and what we can do. Patty says, I had a pelvic floor assessment last week with a urogynecologist, and she poked some really painful spots. I started pelvic floor therapy. You start pelvic floor therapy tomorrow. Tomorrow. Oh, God. No, Tuesday. Okay. You start on Tuesday. Oh, God. I'm not looking forward to Tuesday. Okay. Any suggestions on what I should ask? Also dealing with some ugly constipation that is making my pelvic floor hurt. Well, I mean, you have to let them your job when you go to the pelvic floor physical therapist for the first time is to help them study your anatomy. You've got to be able to walk in and discuss your symptoms in depth. It's not just the frequency, urgency part. You got to pay attention to the little stuff. Like, do you have pins and needles on your skin? Do you have pain to the left of center, to the right of center? Is your high? Is it low? Does it get worse when you bend over? Does it worse when you squat down or when you sit on your side of the bed? Your ability to describe your symptoms is really going to help that person try to study your body a little bit more. And then you want them to watch you walk. Are you walking normally? And you really want to be talking about, is there anything else functionally going on with my legs or with my feet or with my knees or my hips that could be contributing to long-term pelvic tension? We call that a mechanical injury, a mechanical dysfunction. Anytime somebody has long-term chronic pain, we're always going to be looking at bony structures, muscle. We're going to look at hips, SI joint, knees, and feet. Thank you, Sarah. It's nice to see you too. Sarah says, can going without food hurt me? Yeah, girl, listen, your body can't heal if you don't give it nutrients. It needs nutrition. It's about really eating a really good, fresh, healthy diet and losing the fast food and the junk food. There is a ton of food we can eat, but our palate has been adapted by industry. And so we're taught to do spicy potato chips and, pepperoni pizza, both of which are really crap for the body. Whereas if you do baked chicken and broccoli and rice and good stuff like that, and I only use organic flour, but I bake a lot. I made pumpkin muffins yesterday. They're really, really good. All right, so this is about the time that we would normally go into our Zoom meeting. And I want to do that. Holly says, glad your house was saved. I'm doing the clinical trial on Tuesday. I'm worried about the cystoscopies will make me worse. I've been on the diet for many months without cheating. Number one, congratulations, girl, that you're in a clinical trial. That's fabulous. And we greatly appreciate the gift of your time and body to the study of IC. You deserve absolute recognition for that. And for everybody out there, clinical trials are a way for you to get care from some of the best doctors in the world. especially if money is an issue and you can't afford therapy. If you participate in a clinical trial, your medical care is paid for. At least your IC stuff would be paid for, including the testing. Number two, I wouldn't worry too much about the cystoscopy. I mean, listen, the clinical trial guys, they generally know what they're doing, and you can always say, listen, I need you to be gentle. I don't want you to be aggressive. Treat me very kindly, and yada, yada, yada. You know, it's a two-way street, hon. You're still the boss. Even though you're in a clinical trial, you're the boss. You get to decide if you're going to keep doing it or not. And so you tell them, listen, be gentle. I don't want you to do anything over the top. Shandi says, over a year ago, I had my first flare with IC. I came across medical medium information, celery juice every morning, took out all the no foods. I'm basically healed. Awesome. Huh? That's awesome, hon. I've never had celery juice. That's interesting. All right. So what we're going to do now is I'm going to start at the Zoom meeting, but we're going to keep YouTube and Facebook on. So with the Zoom meeting, this is your opportunity to talk and ask questions. We do one at a time. You get to see what coaching looks like because I basically do a little bit of coaching by Zoom. And however many come in, we'll do, and then we'll come back to Facebook and YouTube and round it out for the day. In the meantime, I do need to stop and thank our sponsor, Preleaf. Hello, Preleaf. Preleaf is the oldest supplement out there. Preleaf is composed of calcium glycerophosphate, and what it does is it reduces the acid in foods that you might be eating so that it does not irritate your bladder quite so much. And so if you've got, hey man, I know, of course, this doesn't apply because I don't know about your family, but in my family, we've canceled all the holidays. We are not going to each other's houses for the holidays. We're not. We just, I've got immune compromised people in my family. I've got elderly in my family. Our holidays are going to be Zoom based. But if you were going someplace and you knew they were going to make something that would irritate you, you could do a Preleaf and it might help. It would reduce some of the acid damage. All righty then. So let me go ahead and start this Zoom meeting. All righty, there it is. And I'm going to start the video. The video is now started. And let me get the invitations. All right, so I'm going to put the invites in there. Nikki says, Jill, I wish you could come with me to my doctor's visit. Seriously, I don't think my doctors know what to do with me. I don't think they are interested in helping me. Thank you for your informative talk. Hun, you just pretend I'm sitting right next to you or standing right next to you, and then think, how would Jill react to this? That's a common thing taught in anxiety management classes. Is what they say is pick somebody that you admire or respect, or you like the way they handle themselves. And then pretend that you're channeling them when you walk into the stressful event. And so I picked Shirley MacLaine. She was mine when I did that 20 years ago because she's a redhead and she's a kick-ass woman, and I want to be a kick-ass woman. I am a kick-ass woman, and so are you. And we're going to vote on Tuesday. That's all I'm going to say. No, except I've already voted. So, all right, my friends. So with the Zoom meeting, all right, Lisa's coming in. Let's go ahead and take a quick bio break. I'm going to go use the restroom. I will be back. Please, for anybody who has any specific issues and you want to come and ask about them, please join the Zoom meeting. And there we go. All right. And Lisa, I'm going to mute you right now. I'll be right back. I have to let people in one at a time. Sometimes we get 15 people in there. Sometimes we get 3. Whatever y'all want to do, I am willing to do. Okay. I'll be right back. All righty then. All right. Lisa, you look like you're on a treadmill. Are you on a treadmill or an elliptical? Good for you, girl. I wish I could do that. All right. Is anybody having any problems getting into the Zoom meeting? Becca said, how often do I do this? I normally do it every week, but you know what? I'm amping it up, my friends. I'm going to do 2 a week. You watch. Once I finish this book, which should be done this week, you're going to see me at least twice a week doing support group meetings. I'm going to do drop-in meetings. I just really want to do them. This is the best part of my job, is doing these meetings now. I get to be a real support group leader instead of I am a real support group leader. I have been for 27 years, but this is like the best part. And I'm really trying to improve the quality of information that we're seeing online, especially on Facebook and some of these groups. As an example, that group of people who are continuing to insist that IC is a chronic bacterial infection, and I've just proven that central sensitization can play a huge role in this. Also, we have some really new, interesting. Okay, what is this on my lip? Yeah, I have a hair stuck somewhere. What is that? Weird. We also have some very new information that I can't really go into right now, again, for another related condition that I think is going to be fascinating. Because I don't want anybody to be suffering. I want you all to try to figure out what the hell happened, and let's see what we can do to fix it. And you know what? I'm swearing, and it is what it is. All right, so let's see here. All right, we only have 2 people in the Zoom. That's fine. Let's start with Lisa. Lisa, can you unmute yourself?
There we go.
There you go.
Okay. You can skip me.
Well, that's okay.
You can skip me. I've been walking 6 miles a day.
Wow.
And so I have to do something, like I have to multitask when I'm doing it, because if I don't, I can't get all my stuff done. So I might either watch the symphony, or read a book, or watch TV.
All right.
Listen to you.
Okay. All right.
I heard you. I will just say one thing. I heard you talking earlier about pelvic floor physical therapy. And as you know, I've done that. I did it the first time that I had IC, which was back in 2002. And then I went into remission for 15 years. And then I came back and I did it again for a year. And I swear that's what got me better. So I'm a big believer.
Yeah. Well, and again, I mean, for people who watch me, I really rail against perception that IC is an incurable bladder disease. And so do the vast majority of researchers now. And Chris Payne, when he released his 5 subtypes of IC, one of the things he said is he wanted to fix the misjustice of all these patients being told there's no hope, when in fact there is tremendous hope, depending upon what your variant is. If your issue is muscle driven, that is completely curable. And even central sensitization, we're making incredible strides forward with people getting control over their nervous system, calming everything down, reducing their responses to pain, and so forth. And so, and I am really respect the heck that you are. I need to have a treadmill right here instead of an old chair.
So I live in Houston, and it is way too scary to walk outside right now. Because you actually have to fear for your life.
Yeah.
So I bought a treadmill in the summer. I bought it in the summer. It was too hot to walk outside. But now I wouldn't, believe me, on Tuesday, I won't be going out of my house. So.
Yeah. Are you going to move? Are you thinking about moving at some point in time?
No, because I have everything that I love is here.
Okay.
Like I would lose everything. Like my harp teacher is here, my piano teacher is here, my tennis coach is here. Everything that I love doing is here. So I don't want to move.
Well, what about out of your neighborhood? Would moving, I mean, because again, we're talking about reducing stressors. Is there any chance of moving to a different part of Houston would be better for you?
So when I get older and I can't live in a 3-story townhome anymore, I will move to like a retirement community. So
Yeah. Well, good for you, hon. I'm just, and usually when I finish these, I go out and walk myself, and I just gotta move. So, all right, hon.
but, just to give hope to the people that are on here, and you've known me for a long time.
I have, yeah.
A couple years ago, I was so sick. I was basically on the couch or in bed for about a year and a half.
Yeah.
It was bad.
Yeah.
And now I walk 6 miles a day on the treadmill. So, but it took a long time. It took a really long time. So
yeah.
I guess I saw earlier that Donna wrote, it's a lifestyle change and it takes time and patience. And I totally agree. So
it is. All right, hon. Great to see you. And let us go to whoever's on the iPhone. I have no idea what your name is. All I see is iPhone. Are you there, iPhone, whoever you are? Hello, iPhone. Okay, I'm going to mute you and I'm going to go to Lisa. Let's see if I can get Lisa unmuted. Lisa, you just came into the room. Lisa, can you unmute yourself? Let's see, Lisa, and she says, I don't, oh, you don't want to talk? Well, you guys, okay. Okay, let's let Sharon in. Sharon's coming in. Hello, Sharon. Sharon, can you hear me? It says connecting to audio. There you are. Hey, Sharon. I see you. Do you see me? Can you hear me? Hold on. Sharon, can you hear me? I'm in the text.
I can.
There you are. I can.
You hear me?
Yes, I can. How are
you?
Hey, how are you today?
I'm good. I was actually just shopping, so I'm in my car. But you said something interesting when you were responding to a comment, probably on YouTube, because I didn't see that comment on Facebook. But you were saying that for people whose primary symptoms are urgency, it was someone who said something about they had primarily urgency. In my case, I have the pelvic floor dysfunction and pain with sex, but my most pressing issue is the really, really frequent urgency. And you said something about spine issues, but you said it so fast. I just recently had a CAT scan, and I'm in my car. I'm not at my desktop computer, otherwise I would look at the actual language that it said, but there was something about my spine. And so I wondered if you could elaborate a little bit further on that. Okay. Number one.
Okay.
Yeah.
So understand that the bladder only has 2 functional nerve groups. It's got the C fiber nerves, which are the nerves that control pain, and the alpha afferent nerves, which are the nerves that control frequency urgency. And the alpha afferent nerves are nerves that are meant to be easy to turn on because they're the nerves that are used every day to tell you when you need to pee. So generally, the first symptom somebody is going to experience when they suffer some sort of bladder is going to be frequency or urgency. And the last symptom to go away is going to be the frequency or urgency. And interesting, just to put context in there, the pain nerve is actually pretty hard to turn on. It takes a major trauma for the pain nerve to get turned on. So we have to think first about how is that nerve being stimulated? Is it being stimulated because there is a deficiency in the bladder wall? And so irritants in urine are getting down here and causing an issue. Is it being irritated because, and I've talked about this before, the Somato visceral reflex, where if you have long-term chronic muscle tension, the nerves basically become irritated and inflamed, and they start releasing damaging tissue. So tight muscles also could be contributing to some urgency, but also Tarlov cysts, if you've got something going on around L4, L5, or maybe even on your sacral area, if those nerves are being tweaked there, that also could be triggering some frequency and urgency. Does that make sense? So do you remember what your test results were?
Well, I forget. I mean, that's why I'm in my car. I'm not in the best situation here asking the question. I'm in this Zoom now, so I wanted to I didn't want to miss the window of opportunity. But my question related to that is, well, and first of all, with me, my symptoms are very diet sensitive. Like if I have soda or caffeine or spicy foods, because you mentioned something, you were talking to someone else who said they weren't diet sensitive, and how there can be all sorts of other medical reasons if you're not diet sensitive. But in my case, I am diet sensitive, but I don't. I also had a what do you call it? A bladder, a cystoscopy and a biopsy, and they said that my bladder wall was normal, so I don't have the lesions that you talk about. So I'm trying to pinpoint what is causing because I have extreme frequency to the point that I will have to sit on a porta potty to work. I work as an attorney from home, and sometimes the frequency is so bad that just to even get in, a decent amount's worth of work without having to run back and forth to the restroom, but I have to actually sit there in a porta potty. And so I'm trying. So I haven't found the answer, and I don't know if I will ever find the answer or how long it will take, but I'm just trying to explore every avenue and not leave any stone untouched, so to speak. So
okay, so I know that we talked before, but you kind of have to refresh my memory here. Is this brand new for you? Did it just start in the last year, or have you had lighter symptoms for a long period of time?
No, I was diagnosed with interstitial cystitis back in 2006.
Okay.
And I got on Elmoron back then. It seemed to help. And then I kind of had a temporary remission of sorts. And then in 2017, it came back. And then in 2018, it came back with such a fury that I actually had to take a leave of absence from work. I mean, that was one of the blessings of COVID, is that I can work from home. But when I had to work in an office building, I was having to walk back and forth to the restroom at work so often that I just I felt it was unethical to bill a client for my services, because when you're having to walk back and forth that much, you really just can't even work. And so for a couple months, I just had to take a leave of absence. And so now I'm kind of, unfortunately, I'm sort of back to that really severe frequency. Thank God.
Okay, so
home. But I mean, I'm scared after COVID, if I have to go back to working in an office, I don't want to have to not be able to work because of my frequency.
Okay,
you know what I mean?
So honey, I apologize for asking you this question, but how old were you when your symptoms began?
Well, when I was 5 years old, they dilated my urethra because it was narrow, and so I guess from an early child, But that's either here nor there. That may have nothing to do with anything. But I was, for now.
Okay, so you were 40 when it started.
Yeah, I was 40. Oh gosh, you're good with math. Yes. Yeah, so I was 40. Yeah, I had my son was, my son was born in December 2005. So however old, I mean, I forget the month that it really kicked in, but I guess my son was not even a year old at that time. So I had a lot
so take me back then to the birth.
Oh, well, I had an elective C-section, so there wasn't any trauma on my, in my vaginal area. It was
well, but that's trauma, hun. I mean, that's,
oh, is it? Okay.
Of course, yeah. I mean, they've cut muscles, they've cut nerves, they've cut things open. Was anything, was your bladder damaged at all when they did that? Just out of curiosity.
I mean, not that I know of.
Okay. Is your incision horizontal or vertical?
Horizontal.
Okay. And is your incision sensitive to touch even today?
I mean, I'm not really sure. I don't think so. I don't know. But when you talk about, for the longest time, I just had the frequency. I didn't have any pelvic pain to speak of. And then it was in the fall of October, it was in the fall of 2019 that I first started experiencing pain with sex. And it's not, thank God, it's not to the point that I can't have sex, because it's just upon penetration, I'm like, ow, but I try not to let my boyfriend know, because I don't want him to know that it's stupid that I hide it from him.
Okay. But
because once we get going, it's fine, but that part of the equation, because I hear a lot of women, primarily on your, talks, who don't really talk as much about the frequency and are really more focused in on the pain.
Mm-hmm,
but with me, it's the pain is less of the focus for me, because other than the sex issue, which to me, that's sort of superfluous, because not being able to work is the more pressing emergent issue.
Okay, but I know, but
and not being able to sleep also. I get up, I saw someone on Facebook that made a comment that said, what do you mean sleep? If you have to get up 7 times in the night, that, your REM sleep, I remember, it's been times where if I slept 2 hours of uninterrupted sleep, that was a miracle. I mean, the frequency, it just messes your whole, I mean, sleep is really important. So when you can't sleep and you can't work, and you can, it's really almost, I can see why someone would claim disability for IC, because in its extreme form, it really is debilitating. And I don't want to get to that point where I'm disabled from it.
Okay.
I'm trying to do what I can to avoid getting that deep into it.
Okay. So again, we still have to focus on your anatomy. We have to try to understand what is dysfunctional about your anatomy. So, and it all relates. The fact that that sex is painful, that penetration is painful, tells me that your muscles are tight, right? So when when you go to pee, can you start your urine stream right away, or do you hesitate 5-10 seconds before you can release urine?
Well, that has varied depending on my diet. There was one point where it was so bad that I couldn't, I hesitated. Nothing, just barely anything would come out. So it was not just the frequency, but I wasn't able to pee very much. And then I dramatically reduced my diet to an IC friendly diet. And that was enormously helpful. So now with an IC friendly diet, my flow is greater than it used to be.
Okay.
But I still have the frequency and the getting up at night.
Okay, but again, you're not quite understanding anatomy. So when you're eating foods that cause pain, Your muscles,
Yeah.
your muscles got tight in a reaction to that pain, and that's why you couldn't empty your bladder. And as you changed your diet and you got rid of the foods that were provoking your bladder wall, your muscles got better and better, and you were able to empty your urine more easily. So there's
Correct,
still the
yes.
bladder wall muscle connection.
Okay.
When you think about your latest flare, what do you think triggered it? What does your gut instinct say on what do you think triggered the latest flare, which you say is one of the worst flares?
Well, that is such a complex question to answer because some of it, I don't really know because some of it might be stress related.
Okay.
I've had like my head shaking and weird. And for years I didn't see a therapist, but I've been like, trying to reduce my stress in various ways.
Well, what do you mean by head? Wait. What do you mean by head shaking?
Well, I'm kind of embarrassed. I'm a little bit embarrassed to say this, I guess, is where my hesitancy is.
Well, and we can talk offline. That's okay. But let me just say.
Okay, that's okay. It's just, I know this is public, so I get a little bit embarrassed, because I know the stigma surrounding, but I've always considered myself normal and not, but I was diagnosed with psychogenic seizures. I don't know if you've ever heard of that, but it's where like my head would shake and I didn't know why. And then I was hospitalized. They did an EEG and they didn't find any evidence of epilepsy. So in my opinion, psychogenic seizures is kind of like a default catch-all. Science has not reached the point where they can figure out what is causing these, electrical stimulus in the brain. So if it doesn't fall under the category of epilepsy, they just sort of slap a psychiatric label on it and say, oh, you have psychogenic seizures, which is a way of saying, yes, we acknowledge you have seizures, which in my case, it's not really full-blown seizures. It's just head shaking, like I guess like people who have tics, head tics, stuff like that. But they attribute it to psychological causes.
So I have this. So look, this is what my head does.
Yeah, I noticed that. I was intrigued. I was not intrigued. That sounds kind of a bad way of saying it. But I was curious because there's times where I'll watch you on Facebook and I'll kind of see your head move a little bit.
It's a tremor.
And in the back of my mind, yeah, it's a tremor. Okay.
It's a tremor.
You get it.
It's an inherited tremor disorder. Remember Katharine Hepburn, as she got older, her head shake like this and she couldn't talk. I have that in my family. But in my family, it's mostly shaking fingers. And the only time my head does this is if my neck gets really tight. So if you see me doing this, it means I've been working a lot on the computer and my neck is really, really tight.
Okay. Yeah. So I guess I shouldn't be so embarrassed because, I don't know what causes it, but the reason why I'm even bringing this up, because I'm rambling a bit, is that it's hard to distinguish if my head shakes and they don't know why, and the doctors just say, oh, it's psychological, it's stress, you're just stressed, you need to de-stress, then I don't know if my frequent urination is similar to my head shaking.
No.
In that it's just stress related.
Well, okay. So
my gut, you said, what about your gut? My gut is, if it were just psychological, then I would not have had such a dramatic improvement by going on the IC diet.
True.
Does that make sense? Like if it had nothing to do with anything physical, then I could eat all the spicy Thai food I wanted and be fine, right?
Right.
So, but the difficult thing is that what if it's a combination? Like, just because I know that part of it is physical doesn't mean that part of it isn't also psychological.
Well, I would rather, instead of you using the word psychological, I think you need to use the word neurological.
Well, that's what I have nerve pain that goes from my feet up my leg. You know, I have, you know, I definitely have nerve issues, and with my head shaking, it feels it feels electrical. I don't even know how to describe it.
Yeah. I think, you know, ultimately in the end, you're probably going to have to work with a really good neurologist, central nervous system specialist to try to understand why that's happening. But in the meantime, you do have a history of trauma. You had a history of deep childhood trauma. You know, I mean, they stretched your bladder when you, or your urethra when you were 3 years old, correct? That was you, right?
Yeah, I was in the hospital.
Right.
I don't remember how old. I don't have any memory of it because I was so young.
I know, but see, that kind of brings us back to how I began this whole meeting today and talking about what happens to the central nervous system in trauma. And the fact that you were so young when it happened means you're not going to have memories of it. But the reality is that it was traumatic physically, mentally, and emotionally. And physically, your urethra was traumatized, your muscles got tight in response to that. The nerves may have been compromised because of that. And if you had pain for a longer period of time, you would have potentially developed some central sensitization challenges with how your brain is starting to process some of these pain messages. And it's less psychological and more neurological functioning. And so anything that you can do to try to calm your nerves down, you should be doing. And the reality is one of the reasons why, I mean, listen, you're in a very stressful career. You're an attorney. And you are expected to be on point every single time. Your people are paying you a lot of money. I don't know if you're doing trial work or anything like that. It doesn't get any more stressful than that. And so this is really about teaching your brain how to respond in periods of stress that it's not doing now. Right now, it could be amplifying that, and that might be related to some of your other neurological dysfunctions. That would be my guess. It's just a guess.
Okay.
But I don't want you to carry any shame or blame. There's nothing to be embarrassed about. This is just life. It happens to all of us. And the whole chronic pain thing is something that we're all really just starting to learn with some of the new brain studies that are coming out that are helping us understand why some of us have some of these other, not everybody, just some of us have some of these other related conditions. But that early childhood trauma, I think, is relevant. So I'm going to be, once I finish the book, I'm going to be diving into that research, and my whole issue of the IC Optimist is going to be dedicated to this. And I'm going to keep you in mind, and I will try to ask questions on your behalf with some of the experts that I'm going to be talking with to see if we can really try to understand it a little bit more. All right, hon?
Oh my gosh, thank you so much. You are such a godsend. I can't thank you enough.
You are very, hey
God
man.
bless and thank you.
We are IC brothers and sisters together.
Hallelujah.
Hallelujah, baby.
All right.
Okay.
Take care.
Okay.
All right. Bye. Bye, Jill. Take care.
Okay. Let's see here. Nikki, are you there? Hello, Nikki. Nikki is on her iPhone. Maybe she has gone to use the restroom. So I'm going to mute her, and I'm going to come to, wait, hold on. Nikki, are you there? Can you, there you go. You are unmuted. Can you hear me? Testing. 1, 2, 3, testing. Hello, Nikki. All right. Nikki, I'm going to mute you, and we're going to go to, and I will try to come back to you. We're going to go to Nicole. Oops. Boy, look at you, Nicole. You look great today. How are you doing?
Hey, good. I'm doing good.
Excellent.
I talked to you. I'm the dance teacher that did the Texas
Yes.
dance teams on the phone, and I wanted to give you an update.
Okay.
So
I actually mentioned you earlier.
Oh, really?
I did. We were giving examples of trauma and early trauma, and I said I was working with a patient who was one of the elite cheerleaders who was doing a lot of the split dances where you were landing on the ground.
Yeah.
All right. So what's the update?
So I had found a pelvic floor therapist.
Okay.
And they did an exam. Dr. Rossi Paul, and she is in Plano, Texas, which is very close to Dallas.
Okay.
And she did an internal exam. It wasn't painful.
Okay.
But she said I was all kind of messed up. So I've been going to her once to twice a week, and we're just working on like relaxation and stretching.
Okay.
And the muscle that's kind of been giving me issues. I forgot the name, but
levator, piriformis, obturator, psoas, obturator. Okay.
Yes. And the left hip has been the injury in my dance injury. So
okay.
Just a quick backstory for you guys. I called Jill and I had told her, I was diagnosed with IC, and I gave her my story about dancing since I was the age of 5 and teaching dance and, doing movements that had injured me. And I had kept improving and kept dancing. And she said, Nicole, it doesn't sound like it's IC. It sounds like it's pelvic floor trauma. And so when I spoke to the pelvic floor therapist, she said, oh, she's right. Yeah, she's right. Jill's right. So I'm very thankful still. We're kind of on the cusp, like we're in cusp of relaxing the muscles and stretching them. And then soon we're going to start on strengthening.
Okay.
I do go to another physical therapist who only works on the external muscles.
Okay.
So just everything external about it. So they're doing relaxation with that as well. So I'm feeling pretty good. And on top of using your bladder, calm things down with pain. So I'm in a good spot right now.
Yes.
We're in a spot. I'm very thankful for you. I'm still reading the book, the pelvic pain book. I think that's really helpful. I think any and everyone should get it. I've been taking that book into my pelvic floor appointments, and it's been awesome. But quick question I did have for you.
Yeah.
I finished my bladder builder vitamin. Should I continue with that one? I know like the prevent kind of grabbed my attention because I've had infections like 2 to 3 times a year. I didn't know if I should look at that or just continue with bladder builder.
Well, I mean, I'm a less is more kind of girl. I don't like taking a lot of anything. I think I've been very clear about that.
Right.
What doctors are supposed to ask patients, let's just say you're taking one thing that's helping you, and the doctor is supposed to say, is there room for improvement? If there's room for improvement, then maybe we can try something else. And so that's really kind of what you have to ask yourself. Is there room for improvement here? So, I mean, how old are you?
I just turned 40.
Okay. So we don't have to worry about, you haven't had a hysterectomy, you're still having your periods, right? So we don't have to worry about estrogen atrophy, and the quality and health of your skin is probably quite good, and your bladder wall itself is probably in good shape. So I would go 2 ways. I can see benefit to continuing maybe at a lower dose, something that has chondroitin in it, because it will give you an extra bladder coating effect just to maybe for another couple months or 2. Or again, because of the nature of your trauma, your pudendal nerve took a beating.
Yes.
Big time. And I would be more inclined to maybe want to do something like Peoria for a long period of time, which might have more of a nerve calming effect, right?
I've got the aloe in it.
Well, or you can do Bath, which is the aloe with the PEA in it. But I think doing something that is believed to have a nerve calming effect makes a little bit more sense. But the fact that Bladder Builders helped you is wonderful. And the question is,
I think it's A in it that's helping.
Yeah. And so you could just switch over to the PEA maybe for a month and see if that continues. And if you get worse, you can go back to something with a little bit of chondroitin in it. The nice thing about the PEA is it's the most inexpensive supplement out there. It's like $24.99. And so, you can really see how we're targeting kind of treatment more effectively. We wouldn't just say to everybody needs to be on a bladder reparative stuff, because in your case, there's no doubt what's wrong with you. And it's not your bladder. It's a traumatic injury to your multiple traumatic injuries to your pelvic floor muscles and your nerves down there. So I kind of like the idea of the PEA. I think that'd be a really interesting experiment for a month, and see how you do with it.
And that's the Peoria.
Right.
Okay.
That's this one.
Awesome.
Yeah.
Yay. I'll get that. I just want to tell you, thank you. You've been a huge help.
I'm so glad. I just think that, if you were to come sit in my chair, and I almost want to invite people to come do this for a week. One of the saddest things are people who are told and have been on bladder therapies for years and years and years, and if they're on Elmeron and now their eyesight is damaged, and when you actually talk with them, and that's where doctors don't have the time to really have a good long discussion like I did, because I really had to pull stuff out of you to get the information from you, if I remember correctly. Right. All you have to do is say dancing. Anybody with history of dancing, that just immediately tweaks stuff for me. But there are very clear signs that things other than the bladder are often involved. And it would have been a real shame for you to have been doing Elmeron and bladder therapies for years, because you would never have gotten better. What's going to make you better is working on those muscles and addressing that pelvic injury. So congratulations, hon. You made my day. Yeah, baby. I love it.
Yes.
All right. Well, keep me posted. Yeah, keep us posted. And, I would really love to tell your story in my magazine or on our website. We really need to do a story about dancing and dancers. And would you be interested in doing that at all? Would you be interested in doing that? Oh, I can't hear you for some reason. Yeah, just shake your head. Yeah. Okay. Did I do something to me? No, I'm working. Okay. If you could email me, I'm going to put my email address in the Zoom meeting. If you could email me, I would love to share your story and do an article on it and dancing. Okay. Yeah, I don't know why I'm cutting out, hun. All right. I just lost her. All right. So let's go to Nikki. Nikki, can you unmute yourself? There you go. Hey, girl. How are you doing today? Okay, hold on. I can't hear you at all. Let's try this again. No, still can't hear you. Do you have a headset you could put on? Are you on a cell phone? Are you on an iPhone? Do you have your earbuds for your iPhone? Do you have any earbuds you can put in? Or the Do you have these? You lost them. Crap. All right. I can't, yeah. Darn it. No, still not working. Does it? Okay. She says, 1 second. Hi, Nicole. I know we lost you.
Hey, sorry.
No.
I think my husband said it kicked in and connected on the car when he pulled up. So
Oh.
you said something about an article or something. I'm sorry.
Yeah, no, I'd love to write an article on you and your experience as a dancer and really help people understand kind of the pros and cons of what's happening, but more importantly, the fact that you're doing so much better. I put my email address in the chat. Can you see that?
Let me see really quick. No, ma'am, I think because I left the Zoom
Okay,
to
I'm putting it in. Granted, I say it. I usually say it.
Yes.
Can you do
Yeah,
me a
no.
favor and pop me an email so that you and I can talk maybe this week or next week? Sound good?
Yes,
All right,
of course.
hon. Thank you for sharing your good news. Love it.
All right. Bye.
Okay, bye-bye. All right. So now we're with Nikki. I saw a cat. Okay, still can't hear anything, Nikki. I have no idea. Is there any chance you've got your phone on airplane mode? Check your settings and see if you have your phone on airplane mode. All right. Here, I'll be right back. Yeah. Check your connections on the inside. Check your settings. I'll be right back. All righty. Any success? Sorry about that. Needed to pee. Nikki, let's try it again. Go ahead and say something. Let's see if it works. Testing 1, 2, 3. Nah, not working. All right. So I tell you what, Nikki, our phone number, and let us try to connect this week. Tomorrow is my day off, so I won't be taking phone calls tomorrow, but there's my personal phone number. I just put it in the Zoom chat. And so do me a favor and give me a phone call like on Tuesday or Wednesday in the afternoon, okay? And we will work it out. All right, so I'm going to shut down the Zoom meeting. That is it, because iPhone didn't want to talk and Lisa didn't want to talk. The other Lisa didn't want to talk. And so it's time to shut down the Zoom meeting. And there you go. Zoom meeting is done, over, and we are now back on Facebook and YouTube. We are simulcasting live. This is a national IC support group meeting. These are normally done every Sunday. I'm going to be doing a lot more, especially through the end of the year, because basically I think we all need the comfort. I do too. It's wonderful to break the isolation of being homebound and actually have people to talk to. right? So Nadej is asking, what's the pelvic pain book? The pelvic pain book is called Breaking Through Chronic Pelvic Pain, a Holistic Approach to Relief. And you can find that over on icnetwork.org. Casey says she's got to leave. All right, not a problem. You guys, understand that I'll talk about anything. And man, I'll talk about anything. There's nothing out there that's going to embarrass me. You want to talk about pooping? I can talk about pooping. You want to talk about hemorrhoids? We can talk about hemorrhoids. You want to talk about sex? We can talk about sex. You want to talk about supplements? We can talk about supplements. Not a problem. Kim Bagwell says, what are some tests that would help rule out an abnormality with the urethra or the flow of urine while traveling through the body? I was diagnosed with IC around 2005, but also known that I have some sort of an impediment of some sort that impedes my urine flow, passage of stool, resulting in blood in the stool, weak and slow urine stream, chronic nausea, pelvic, abdominal, and groin pain, rib, sternum, and bone pain, dizziness. Well, honey, bladder disease is not going to cause dizziness, right? And let me ask you a question, because I went through this. Have you ever gotten nauseous when you've tried to have a bowel movement? Do you ever have kind of this wave of nausea? Just like you're just wanting to do your thing, and all of a sudden it's like, ugh, and the room kind of swims a little bit. So you're asking if there's an impediment. And so we have to think about anatomy for a moment. Impediment implies that there's some sort of blockage. So remember, it's your bloodstream that delivers whatever needs to be excreted to your kidneys. And then it is your kidneys that collect the irritants and collect the waste that your body's getting rid of. And it's your kidneys that create the urine, which then passes down the ureters and arrives in the bladder. So concept number one, is your kidney function okay? You can ask your doctor to check that. There would be a very simple blood test that they can do to see if your kidney function is okay. One of the things that's really interesting is that if you are older and you have heart issues, that you might notice that you get up to pee more at night and that you have more volume and your body is producing more urine. Because when you have like congestive heart failure, when you're laying down, that it's easier for the body and the kidneys to do what they need to do. And that's not the exact correct explanation, but that would be something potentially we could look at. Question number two is, if the kidneys are fine, the question is the bladder okay? And yes, there can be a bladder abnormality. There can be a birth defect. If your nerves aren't functioning correctly, you might feel a need to pee all the time, or you feel the need to pee at all. You know, if you've ever had anesthesia and you wake up from anesthesia and you can't feel your bladder for hours, and then finally you start screaming because you got 1,500 cc's of fluid in your bladder and it desperately needs to be emptied, and the anesthesia is just worn off, right? So we could see some nerve abnormalities going on. But when we think about obstruction, to me, we're always thinking about tight muscles. And let me explain why. Let me just get that. I will bring out my favorite thing to do, which is to bring out my pelvic cavity. So hold on, I gotta take my vagina out of there. Got my bladder out, got my bowel out. All right, I'm gonna take, so here we have the pelvic cavity, right? And the pelvic cavity is the center of the human body. The hip bones are designed to carry the weight of your torso. So one purpose of the pelvic cavity is to keep you upright. The second thing that happens is that the any stresses and strains from your feet and your legs as you walk are going to be directly reflected right up into the pelvic cavity. It's kind of a buffer. I don't know if buffering is the right word, but it absorbs stresses and trauma. You've got, right? Because you've got muscles in your that come and connect all the way down into your pelvic cavity. Muscles from your legs also come up and connect to the bones in your in your pelvic cavity. So it really is the center of the human body. But what makes the pelvis all the more complex are the muscles, because the muscles do a lot of different things. So the muscles, the skeletal muscles or the striated muscles, are the muscles that you move with. So you've got muscles that help you open your legs in and out. You've got muscles that help you walk. You've got muscles in your, I mean, they're just movement-driven muscles, right? But another purpose of the pelvic floor muscles, and here are the pelvic floor muscles right here, whoops. Okay, is to contain and hold your organs in place. Right? This is what keeps the stuff inside your pelvis where it's meant to be. If you have weak muscles, things are going to fall and you're going to become incontinent and things are going to fall. If you've got tight muscles, it might be hard to pee. And let me explain this. So what makes these muscles all the more interesting is that they're the only muscle group in the human body that actually control major bodily functions. Because, for a woman, there are three basic holes in the muscles. You got a hole for your urethra, you got a hole for your vagina, and you got a hole for your rectum. But there's muscle around each one of those holes. And there's shallow muscle that wraps right around your urethra, right around the entrance to your vagina, right around the rectum. And if we look at this, we've turned this on its back now. Here is your pelvic floor muscles, and here are your levator ani muscles, and you can see the holes. So here's the hole for the rectum, here's the hole for the vagina, and here's the hole for the urethra. So if these muscles are tight, what do you think is going to happen? It's going to be hard to pee. You're going to sit there for 5, 10, 15, 20. Listen, the first time I left for this chat, I had to sit there for 5 seconds before the muscle would release. Okay, why? Because I know I've been sitting. My pelvic floor muscles are getting tight. That's like the first sign that my muscles are getting tight. So it's going to be harder to pee. It's going to be harder to have a bowel movement. It's really hard to have a bowel movement when your muscles are tight because it's holding everything in. And it's going to be really hard to have sex. Putting aside from letting something out, putting something up there is not fun either if those muscles are tight. And so when you talk about improvement, the most logical thing that comes to my mind is, in fact, the health of your muscles. And you can see, look, I'm going to take these levators off. These are the shallow muscles. But then you've got deeper muscles in here. These are the mid-level muscles. And then if we go in here and look, I'm going to put my finger where they would put your finger. You can see we've got muscles that are very high, right? Your piriformis muscles. And so if any of these muscles are tight, it's going to be hard to pee. I don't know why you would have blood in your stool. That is a concern to me, and I would think that they would want to be doing a colonoscopy immediately. That is an important question to ask. There should not be blood in your stool. Sometimes if you have an autoimmune disorder like Sjogren's syndrome, the little blood vessels right below the stomach can weep. My mother has that. She has anemia constantly with her because the little blood vessels kind of weep at times and make her anemic. So I would want to know if you've got dark blood in your bowel movements, you got bleeding higher up, and they have got to get to the bottom of it. And to me, that is an extremely urgent situation. And I would be calling your doctor tomorrow and tell them that you've got dark stools as well as bright red stools. And they need to check that, hon. That's just not normal. The nausea, sometimes patients with sensitive central sensitization have vagal nerve sensitivity. That's kind of what triggers the nausea with bowel movements. But girl, the fact that you got blood in your stool is deeply worrying to me. And I really would want, that's not a bladder issue. That's a separate and distinct issue. And you need to get to your doctor immediately and have them check that out. Okay. I'm sorry, hon. I'm sorry. I mean, it happens to all of us, but I think a colonoscopy is going to be in your near future. And I think it's the right thing to do to try to figure out what could be bleeding. So please talk to your doctor about that. And for any IC patients who are worried about going through a colonoscopy prep, it's really rare that IC patients react to colonoscopy preps. The Miralax protocol is really gentle. It works really well for us. And I have an article over on our website at icnetwork.org on colonoscopy preps. I'm going to be due for one probably, and then I'm going to wait until after COVID unless I have any issues. But probably in a year or two, maybe. We'll see. Vicky says she noticed that. She notices, yeah, you listen, you always, if I start doing this, that tells you I've been on the computer way too long. And I have a, I was just reading a section on trigger points and TMJ, because I have TMJ too. And they were talking very specifically about the sternomastoid muscle, which is this muscle. Like you can see it, the muscle right there. And they say that the secret to controlling TMJ is to get rid of any trigger points on this muscle. And let me tell you, I have had a trigger point right here for a decade. Like it's right there. And it's like, oh, see, there it is. Oh yeah. It's like, oh my God. It's so tender. It's like the size of an almond. And I cannot get rid of this damn trigger point. So I have one of these jade things and I just kind of, ooh, there it is. Ooh, I can get it down to half the size, but I can't get rid of it. It's always there. Ooh. But this is kind of a good example of what they do with pelvic floor physical therapy, right? Is with their fingers, they follow the length of the muscle, right? So you see kind of what I'm doing there on my neck is I'm following the length of the muscle. And there it is. It's right there. Oh, go away, go away. I don't know why I've always had it there. I think it comes from I got rear-ended. I've been rear-ended twice and I got whiplash. And that's when this happened. Oh, okay. Nancy says, my back pain is bad, burning sensation in the urine area. I've been taking Alleviate capsules from Desert Harvest. I think it's the pizza I had. It didn't bother me before. Well, hon, so the bladder doesn't cause back pain unless it's your kidneys. So if you have sharp pain in your lower back, that could be a kidney. But a painful bladder will cause the muscles to get tight. And so you had pizza. God forbid it be pepperoni pizza, which is just about the worst pizza you can eat because there's so many preservatives in the pepperoni and spices. It's just not the right thing for us to do. Guys, if you need to do a pizza, get a white sauce or don't even get sauce at all. And you can get chicken, you can get ham, you can get olives, you can get green peppers, you can get stuff like that and enjoy a pizza. We just want to pass on the spaghetti sauce and the pasta sauce and of course the things like pepperoni. So aloe can be soothing, so that makes sense. But we have something I think that's a little bit better called Aloe Path. And that is, where is it? Oh, guys. Oh, wait a second. I totally forgot. I totally forgot. We got a whole bunch of new stuff for the store. I've been meaning to send out an email and I haven't been able to yet. So Allopath is aloe combined with PEA for the pain fighting effect. And so I think that this has more methods of action and has the potential of being a bit more effective. So Allopath would be ideal. So it's just taking aloe to the next step by adding PEA to it. Marshmallow root. So we've known for many, many years that marshmallow root tea is comforting and soothing for some patients, but some patients flare from it. But I did find a new supplier for marshmallow. So if you wanted to try marshmallow root, we now have that in our store. I do have from Nature's Way a vitamin D3 for people who are looking for a D3 that is kind of pretty pristine and pure. Calcium, magnesium, and vitamin D. Right. For people who don't have Hunter's lesions, who are trying to improve their low vitamin C, we've got Ester C, which is a calcium ascorbate instead of ascorbic acid, which is a lower acid vitamin C that some of you may be tolerated, but not if you've got Hunter's lesions or extreme estrogen atrophy. The odds are your bladder isn't going to be able to do that. We've got. Okay, hold on. Okay, this is going to be cool. Wait. This is going to be cool. Okay. So people always say, what do you drink, Jill? And I have to, now that I've had, my heart is being all weird again from me not eating properly and having a potassium issue. I can't do any coffee for like 6 months to a year, according to the cardiologist. Okay, so what do I normally drink now for my hot drink? This is exactly what I drink. It is from Harney & Sons Pumpkin Spice Rooibos Tea. And it's not super spicy pumpkin-y. It's just this really mellow, caramely-like, warm brown herbal tea. I could drink this I could have cups all day, every day, and it's never flared me. And I've been drinking this for years. So we finally got some more in. So if y'all wanted to try a different brown herbal tea, this would be fun to try. And again, even though it says pumpkin spice, it's not pumpkin-y. It's just kind of more like folly, like autumn. The same company, Harney & Sons, now has a new line of teas with CBD from hemp. And I got the chill tea, which is chamomile, which we know is calming, soothing to the bladder, combined with a little bit of CBD from hemp. And so what they are saying is, so this is called chamomile mint. Chamomile and mint are masterfully blended to create, hold on, I'm wearing my computer glasses, not my reading glasses, to create a caffeine-free herbal infusion. It's combined with 16 milligrams of hemp extract to make a delicious brew to end your day. And so our body-relaxing, mood-elevating infusions deliver a cool, calm, and delicious experience like no other. We strive to make it all just a little bit nicer in everything that we do. Our philosophy being the roots up. Well, anyway, so this is from Harney & Sons. And so anyway, chill, peppermint, chamomile, and hemp, a CBD from hemp herbal tea. I don't know. It looked interesting. And, I'm all about options. Every year we do surveys and we ask patients what their best cold and flu strategies are, because obviously doing things with lemon are not really ideal for us. Although any honey product is always a honey throat lozenge, cough lozenge. They're always the favorite for patients with a sensitive bladder. But in every single one, patients talk about traditional medicinals Breathe Easy and traditional medicinals Throat Coat. I mean, I've been surveying patients for years about their favorite cold and flu strategies, and these come up every single time. Every single time. And ironically, I served on the board of directors of a nonprofit with Drake Sadler, the guy who started this company, only I didn't know his company back then. This was back when I was in grad school. So anyway, the throat coat tea has licorice root, slippery elm, marshmallow root, fennel, cinnamon, little tiny bit of orange peel. Remember, orange peel, lemon peel don't have the same acid level that juice would have. So you can get away with a little bit of orange peel. Now, with licorice, you have to understand that you can't just do a lot of licorice because it can mess with your heart rhythms. And if you have a potassium issue, so like I can't use this right now myself because my potassium was a little low. But anyway, we've got throat coat and we've got breathe easy. I just thought it'd be interesting to try, stock up, have some ideas for patients. And then of course we have the organic chamomile herbal tea. The number one tea for patients with a sensitive bladder is going to be organic chamomile, organic peppermint. Again, very calming and soothing. There's research that shows that if you're going to have a colonoscopy and you do have, and you have a hot cup of peppermint herbal tea beforehand, that it will calm the spasms in the smooth muscle of the bowel. We believe that same thing happens to the bladder. And then, of course, we also have some organic fennel. I personally love fennel myself. And that really can help the gut. And if you have gas, if you struggle with gas on your stomach, fennel is something that we would turn to. We also got some organic coconut oil for a dry skin down there. And I actually also got a couple of, for people who are super, super sensitive, finding shampoos and conditioners and things like that are hard. And so I actually brought in the shampoo and conditioner that I use. I just got a little bit, like 6 bottles, just get some people. It comes up. Let me show it to you really quick. Earth Science hair mask, which is the what I use. Anyway, I've got some Earth Science shampoos and conditioners, and then I've got this too. They're not up in the store yet, but they will be probably in the next week or two. And we also have another product coming in called Cystomend. Another product made by Natural Approach. Oh, I've got 2 products coming in from Natural Approach Nutrition. Cystomend is it's a chondroitin-based supplement like Cystoprotect and like Bladder Builder. But what they've done is they've added pumpkin oil to it, pumpkin seed oil, which has really good research behind it for supporting a reduction in irritation and I think inflammation. And so Cystomend should be here this week. And and I can't talk about the other one. I'm not allowed to talk about the other one yet, but it's pretty exciting. And don't forget, we have if you need a vitamin, vitamins are very hard on IC patients because they're remarkably acidic. So we do have a vitamin called Bladder Smart. It is a low acid vitamin. It was originally my idea. I was the one who helped create the very first low acid vitamin 10 years ago called Multi-Right. We discontinued Multi-Right because the pill is just too big, and we've replaced that with Bladder Smart. I'm just thrilled with this. This is what I take, and I've never flared from it. And so again, if you're looking for a vitamin, you could do that. And then, of course, we have the chondroitin-based supplements. So we've got Bladder Builder, Bladder Rest, Cysto Renew, and Cysto Protect, right? And so if and I never wanted to be in the business to sell supplements, and I'm very clear that you need to do your research, talk to your doctor, try to understand mechanisms of action. Just because we sell them doesn't mean that it's something you should try. But if you're transitioning off of Elmeron and you're looking for something that would have a bladder coating effect, generally what we would do is look for chondroitin-based supplements. And so patients have been transitioning off of Elmeron for years now because they couldn't afford it. So trying Sister Protect or Sister Renew or Bladder Builder or Bladder Rest or Cystomend would be reasonable. So, all right, well, Lisa, got any more questions? Kim Bagwell says she has nausea all the time. That's not good. Debbie says, my colonoscopy saved my life. Never felt any pain. I've had 2. Laura says, instead of a colonoscopy, I did a Cologuard test. Kim says, frequency pain are ongoing. Thanks for all of your input. Took physical therapy 15, 17, 18. No stamina, energy to drive over an hour each way to pelvic floor physical therapy. So you had to discontinue. You had a colonoscopy in June 2020. This was your 5th one since 2011. What did they find in the colonoscopy? Anything? Did they have an explanation as to why you have blood in your bowel? Allison said she missed the teas we were holding up. So a traditional medicinal throat coat. But again, you only use those for very short periods of time because they have licorice in it, and you can't do licorice every day if you've got issues. Breathe Easy. The all-time favorite herbal tea of the IC Network, Pumpkin Spice Rooibos. Never had a patient flare from this tea that I'm aware of. I don't remember anybody ever calling to say that they flared. And we've got Harney and Sons Chill, which is peppermint chamomile with a little bit of hemp. And then, of course, we have the organic chamomile, peppermint, and fennel. Yeah, just come on over to our website, icnetwork.org, and click on the store. It's in the upper right-hand corner. And come check out and see what we got. All right, my friends, I think we should call it here. It is 3:27. I think we've been going at this for 3 hours. Sounds good to me. So you can expect me again next Sunday, barring fires, and expect to see me more often. If you have any questions, you know how to get a hold of me, you can come on over to our website, icnetwork.org. There's a contact form. I will give you my top secret email address. And my top secret email address is icnetwork@mac.com. M as in Mary, A as in Apple, C as in Charlie. icnetwork@mac.com. But don't call tomorrow because I take Mondays off and I have to clean my house on Mondays. All right, my friends, I will see you later. I wish you well. Vote, 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 vote. Like you've most important election of our lifetime. So please, please vote. Even if you're in pain and struggling, please get out there and vote. All right? Okay, my friends, I will see you later. All right, YouTube, I will see you later. Shandi said over a year ago, I had my first flare. Oh yeah, that was the celery juice. All right, my friends. Listen, I'm willing to stick it out if anybody has any questions. If not, we can call it. You all want to talk about the election? I'm happy to do that too, as long as we're not on Facebook, which is a very hard place to talk about politics. All right, my friends, I will see you later. Vote! I don't want to be accused of being political, but I think you know who I'm going to vote for. We'll end it with this. There is nothing radical about moral clarity. Creating an environment for our children without lies. All right, I'll see you later.